So good afternoon. My name is David Fleming, and I'm the President and CEO of Donate Life America. And it's my honor and privilege to welcome you to a conversation today that we believe will be both inspiring and educational. I think it's fitting on today, the last day of National Minority Donor Awareness Month, to be having this conversation. We're going to have an opportunity to hear later in our conversation today from Dr. Clive Callender, who is really the grandfather of National Minority Donor Awareness Month. We have been privileged to watch this celebration, this observation and observance increase from a day to a week to a month on this 25th anniversary. And we look forward to hearing from Dr. Callender later today. I'm also proud to be joined on camera right now with Bobby Howard. Bobby is the Director of Multicultural Donation and Education Program at LifeLink Foundation in Georgia. So welcome, Bobby, and we look forward to hearing you in a moment. I wanted to start by using an iconic phrase that was created by Al Michaels in 1980 when the United States hockey team upset the Soviet Union in hockey. And it's, do you believe in miracles? And I personally believe in miracles because I'm privileged to see it every day. What we're going to be talking about today is no exception. And that's VCA, or otherwise known as vascularized composite allograft. So specifically, what we're talking about today is the simultaneous transplant of multiple elements of the body. This can include skin, bone, muscles, blood vessels, nerves, and connective tissue. This is an incredible therapy that provides vital function, and I think importantly to mention, identity to people that have suffered devastating injuries or illness. It is truly a medical miracle that happens because of the generosity of donors, the generosity of their families, and it happens at the hands of our incredibly talented medical staff and surgeons around the country that make these modern day miracles happen every day. Something important to mention before I turn this over to Bobby, to have a conversation with our incredible guest that we have today, just an incredible group of people that are going to help educate and inspire you relative to VCA transplant. And the distinction I want to make is to make sure everyone understands that VCA donation and transplantation requires a separate authorization for this donation to occur. VCA donation is never assumed with a regular registration to be an organ, eye, and tissue donor. It requires a specific authorization by an individual if they've happened to make that wishes known to their family before their death, or it requires the family to consent or authorize VCA donation. In our world, typically a VCA donation looks like a hand or a face transplant. But once again, we're so excited to have you here today. We welcome you. And now I'm going to hand this over to Bobby Howard to continue this conversation.
Thank you, David, and welcome everyone. This is an exciting program. I am so excited to be hosting this. And on the very last day of National Minority Donor Awareness Month, can you believe it's been 25 years since this celebration and this observance was started? But without any further ado, this is going to be a very, very enlightening discussion. So I would like to bring on two very, very special people. First, we're going to have Dr. Velma Scantlebury, professor of surgery, and she's also the first African-American transplant surgeon. And she's going to be interviewing Mr. Robert Chelsea, the first African-American transplant recipient in 2019. Dr. Scantlebury?
Thank you so much, Bobby. So delighted to be here. And with us, we have Robert Chelsea and his godson, Everett, who's going to talk to us about their experience. But let me give you a little history about Mr. Chelsea. Mr. Chelsea was driving from church on his way home in 2013, and his car became overheated. So he pulled to the side of the road, and unfortunately, very unfortunately, an unthinkable thing happened. A drunk driver slammed into his parked car that was disabled, immediately setting it into flames, causing him severe injuries as it exploded. Thank God for the heroism of a bystander that allowed him to be transported from the accident, which he survived, but only after multiple surgeries and a wealth of complications. He then suffered some remarkable facial disfigurement. So, Mr. Chelsea, tell us how disabling were your facial injuries, and what made you decide to think about a face transplant?
My lips were burned off, and part of my tongue, part of my nose, ears, and of course, actually from top to bottom. I don't know if you can see my hands, but my hands are cadaver skin. So in the burns, it was from top to bottom, basically. I can't say what percentage. You talk to one person, who'll say 45%, one will say 60, 50, 75. But nevertheless, it was horrific. At least it looked that way. So that's basically what transpired and why I considered face transplant. Should I let you know how it came about? Or?
So I'm going to ask you basically, how long were you in the hospital, and what role did your family play in helping you with this decision to seek a face transplant?
Well, I was in the hospital a year and a half. The first 6 months I was in a coma, and then of course the rehabilitation took place after that. So I stayed in the hospital a year and a half. I still couldn't walk, or nor could I. Well, I couldn't stand. I couldn't stand. I had to have bed baths when I was discharged. So my family, I had a tremendous support. My family is the last name Chelsea, so it's very small, but nevertheless, God's people just overwhelmed me with love and time and support, and as a result of that, it really did take a whole village, or I appreciate that village stepping up to assist me.
So I think we should also note that you couldn't eat or drink without holding your head back, as well as having some type of towel or something to wipe away food that was falling out of your mouth as a result to not having lips.
That's correct. When you have your mouth open, people say, well, just put a mask on. Well, with no lips, the saliva wets up that mask in seconds. So I couldn't just keep a mask on all the time, because wherever you walk, and don't try to run, all the dust and dirt and flies and everything else goes in your mouth. But that was okay. It's had the accident not occurred, I wouldn't be here today, rejoicing at what the experience that I've had, that is with God at the helm and a medical industry in support of it.
How disabling and how did your injuries play a role psychologically in your relationship with your family?
There were pros and cons. I'd say, if I used 100 people, probably 80% of them were angry with the drunk driver, and they would claim that I didn't deserve it and all those kind of things. So I had to explain to them that this experience was, in spite of how it looked, it was. I wouldn't want to turn back. It was that kind of experience for me, because God He just had His wonderful hand on me.
Yes, absolutely. Absolutely. Go ahead.
I was just going to say, in addition to that, my mother, one of his closest friends, what he may have forgotten is her experience. She's the type of person that gets uneasy going into hospitals. So she did not pay him visits in the hospital. And it took her a long time before she could really gain the strength to see him, not because she didn't want to see him, but because it hurt for her so much to be in his presence.
Absolutely.
I'm glad you mentioned that, because I did go through quite a few people that I knew. When I'm looking at them, I know who they are, but I'm all burned up, so they have no clue of who I am. And I would approach them, "Hi, John," and John would be shocked. Who are you? And I'd talk to them. And later on, one incident, a guy called me back later on that night and said, "Robert, I did not have a clue who you are. So and so told me who you were, but I had no clue. Even though you talked to me, but I had no clue who you were." So that happened quite a bit.
I'm sure they did. So tell us about the evaluation process and your workup process to getting a face transplant. Was it very intensive?
It was intensive, considering the every major department in the hospital. This happened to be at Brigham Women's Hospital. They had the oncologist, the hematologist, the psychological department, all the surgeons, the general, the pharmacy, the general medicine rather, they all had to evaluate me one-on-one to see if they felt I would be able to endure. That is the overall process. It's not about just having a face transplant. It's the post surgery is what you're going to live with the rest of your life.
Absolutely.
And they had to make sure in their mind that I was willing psychologically to go through it, that I was enthused over it, and of course eventually they decided that. So I went through a 3-day process at the hospital in Boston, and then I was brought back for 5 days for an additional evaluation. So
just to add a little drama to this, they also ask and want to see if you're prepared for death. So this process is super intense, and I'm just witness to it all. But I recall a meeting with our lead surgeon saying, anything could go wrong here, including you lose your life. And so they're evaluating you through all types of processes.
Absolutely. And I'm sure that once you were listed as for the face transplant, as an African American, we all have different shades and not as easy to match skin tone as compared to a Caucasian. So tell us about that process. And did you have the option of considering other offers that you might not have accepted based on not the right color?
Yeah, they had to devise a color chart. Yes, and it came up with about 18 different color shades of African Americans. So as a result of that, they let me select between number 8 through 16. 18 being the darkest, 1 being the lightest. So I chose between 8 and 16. That we got no response whatsoever for maybe a year. And so we changed it to 5 to 16. And we came up with one donor that was a family that was willing. And unfortunately, their complexion was very light, so I rejected it, and I decided I would just wait because I was already comfortable as a burn victim. I know that sounds kind of unusual, but I just had that covering, and as a result of that, it could have went either way. So I did wait until Dr. Palmerhout called and said they have one that they think is the best match for me.
Awesome. And we know that as a face transplant recipient, you have to take these medications because there's always that thought of rejection. So have you had any episodes of rejection, and psychologically, was it hard to deal with if you did?
Yes, I had several. I had infections as a result of my own body.
Immune system.
Everyone's body is different. I might have had in this case, I didn't have, I never drank, I never smoked, I didn't do any else. So, I had a little different, my body was just made up a little different. So as a result of that, my body rejected several medications, but I had no pain. It was just through the blood test that they could determine that I had a particular infection. So several of those took place, and by God's grace, even through the 2020, I was in the hospital 8 separate occasions.
So I would also like to note, Doctor, you present these questions to Robert as to how he felt. And sometimes I always remind everyone it discounts the family members who are there in fear of reliving the surgery, which is, life risk, risk taking, and then also the medications. What's really important to note is Robert takes over a dozen, I guess we're almost at 24 medications, 3 of which are to prevent rejection.
Absolutely.
You cannot forget these 3. If you do, you increase your chances of the organ or the body rejecting the organ by 100-fold, I think. So it's really important to note that you're not just on medication. You have 3 medications that are critical to your survival.
Very important. Absolutely. And you live in fear of, what happens if you lose it, if you reject this? What would happen? Would I, would it get swollen? Would I need another face transplant? So those are things I'm sure you have to deal with across the board. So it's been over 2 years since your transplant?
Yes.
And so how has it changed your life? Mm-hmm.
Is it possible, in sake of time, I know this is a great conversation. I really, really hate to cut you guys short, but, based on our time, then we have a couple other presentations that we'd like to get
Absolutely.
to.
Absolutely. So I just want to say this has been a wonderful journey. Thank you for being able to have this conversation with you. Yeah. And we'll be able to talk again soon. So we'll pass this back to Bobby.
Thank you, Dr. Scantlebury, and thank you, Mr. Chelsea, and thank you, Everett, for this wonderful, enlightening information. Now, ladies and gentlemen, I would like to bring on Mr. Stephen Averhart, Family Services Manager for New England Donor Services. Many times that when we have these conversations, we talk about donation, we never truly hear the other side of what that conversation's like with working with families. So, Mr. Stephen Averhart, can you tell us, what is Family Services? What do you do?
Well, Bobby, thank you for that question, and it's a pleasure. Thank you all for joining us today. Basically, family services coordinators, and they are also known as donation specialists and organ requesters. What we are tasked with is interacting with families, quite possibly on the worst day of their life, when they are on the cusp of losing someone that they care dearly about. And when appropriate, and I do use that term loosely, we have a conversation with these families to try and paint a picture of transcendence, letting them know that their loved one has the ability to give one last act of kindness and try and make this world a better place. In those conversations, we're certainly talking about organs and tissues, and every once in a while, when there's a need, we are discussing the opportunity for VCA.
That's great. That's great information. So, Stephen, but out of curiosity, when you have these discussions with the family, what is that conversation like? What is the mood like? Can you give us an example or try to go a little bit into what's that setting like?
Sure. Well, as you know, Bobby, you've been doing this a long time. Every family is different. So we give what the family gives to us, right? We have to meet them where they are. Every family grieves differently. We have all different types of religions and cultures. But if their loved one has made it to the hospital with a devastating injury, and are eventually declared brain dead, or the family has come to a point where they say, you know what, Stephen wouldn't want to live this way, we would like to withdraw support. At that point in time, when those decisions are made, or the family is close to making that decision to withdraw support on their loved one, we introduce ourselves, we let them know that their loved one may be registered as a donor, if in fact they are, and if their loved one is not registered as a donor, we try and invigorate the family to make that decision on their loved one's behalf. And the goal of that is to yesterday, today, and tomorrow make this world a better place, and make sure that that family is not leaving that hospital empty-handed. because let's face it, we cannot control when our day-to-day is coming. It's already written. But what we can do is give these families something to hold on to that's meaningful, that will help them in the years to come to get to some place of peace and solace.
And that's good to know. And also, so often, we may hear of how do you take care of the family? What is that conversation like? Do you really care about the family, or is your main objective and your goal is just to get this family to say yes and recover their organs and tissues for transplantation? So if you can just give us a little idea, how do you take care of the family? How do you really get into depth in making sure that family's needs are being met?
Great question. And simply put, with empathy and compassion. The reality is that donation is not for everyone. And so if a family indicates that they have no desire to allow their loved one to be a donor, that's okay. It's all about the interaction, never about the yes or no, because the reality is that that family will interact with us at some point again. And so we want to treat them with the utmost of respect, letting them know that it's okay if they happen to say no to donation, but also painting that picture of transcendence that I mentioned earlier, letting them know that this won't do anything for you today, but it can do something for you tomorrow and years to come from now. In addition to that, we're helping families, providing them with resources if they're looking for a funeral home, if they need information on, how to get their loved ones' belongings. And, all is not lost. Once someone goes ahead and gives the gift of life, we are able to provide gift disposition, ages and genders of these recipients. And as we and every other OPO, to my knowledge, we have an excellent aftercare department that holds the hands of these families for that following year to make sure that all their questions are answered, any inquiries or concerns that they have are addressed. And so we do not abandon them; we stay with them.
So you wear many hats, so to speak. You wear many hats in that room as you're working with the family, which is just wonderful to hear. And as we continue to move and talk about donation, it's becoming a regular part of our conversation. Can you just share with us how important is it that we have those discussions with our family members upon our decision on what do we want to happen with our body when our life is over? How important is it that our family members know what our decision is?
Bobby, it means everything. And the reason that it means everything is because we can register as donors all we want, but if we are not declared brain dead, the family still has the authority to say, you know what, I'm overwhelmed with grief. I know that this is what he or she signed up for, but I'm an emotional wreck. I don't want my loved one touched. Having those conversations at the dinner table, at the ballpark, wherever, really helps the donation process tremendously, because at that point in time, you've made the decision so that they don't have to. And so it's one less thing for them to worry about.
Stephen, I just want to say thank you so much. Thank you for what you do. And due to our time and where we are, we can talk about this for days and days upon end. But I just want to thank you for what you do. And thank you for coming on just to enlighten us, to give us a little bit more information on what those family discussions are when the family is at sometimes their darkest time in their lives, that they really have to make a decision for their loved one. So thank you so much for having this conversation with us today. Hopefully we can continue this in another venue to really give an inside look to what it's like to be a family service care person and someone who really works with family, who really has passion for that family. So thank you so much.
My pleasure.
I think we do have a few minutes for questions before we bring on Dr. Clive Callender, who is the architect and the founder of National Minority Donor Awareness Month. Is there any questions that anyone may have? You can place in the chat and hopefully we can answer. We have time for maybe one or two questions. If seeing none and hearing none, I would like to bring on a Dr. Clive Callender, who's a gentleman I've had the opportunity to have known since I started into this field of organ donation and transplantation. He is the founder, the architect of National MOTEP, and he's also the founder of National Minority Donor Awareness Month. So Dr. Callender, can you take us home, please?
Yes, quite a delight to join you. This has been an incredible program. And as I look back over the 25 years of this, event. It's just exciting to see that this month has been the busiest I've ever had. And our goal has been to educate and empower all minority communities everywhere to love themselves, take care of themselves, to prevent organ failure in the first place, and then move from awareness to action to accountability. Because what is so important, as you've emphasized, is actually the act of donation, whether it's organ tissue. It doesn't matter, because organs save lives and tissue enhance lives. And so seeing what we've accomplished so far, and as we prepare to go into the future, I'd like us to emphasize trying to do even more community education and empowerment by all means necessary, going into the community as we can. Also, further diversifying to the extent that transplant health professionals actually go into the elementary schools, because it does two things. One, I think the earlier that kids know about diversity, and the earlier they are able to overcome the issues of institutionalized racism, which is one of the greatest obstacles to our success. Distrust and all of the many other things relate to the fact that one group is thought to be inferior to another, and we've got to stop that. And one way to do that is to have minority health, transplant health professionals to go into the elementary schools along with the donors and recipients, and let them know that diversity begins early. And so that this is one of the other things we need to do. The other thing we need to do is also to recognize that it is so important for us to address the political and social determinants of health that make so much of a difference, and are ways in which institutionalized racism has affected us. We know about the need for vaccinations with COVID, and we know that our population is more likely to die when we get COVID. So it's important for us to bridge the gap and go into the community, educate by whatever means possible. And so as we go into the future, we have to be aggressive and by all means necessary, do what we can to address all of the political and social determinants of health, because the end result will be better lives for all Americans and all human beings. And I'm so grateful to have the time, the opportunity to say a few words to let everyone know how happy I am that National Minority Donor Awareness Month has been such a success, and how we look forward to the future for it to be an even greater success as the years go by.
Thank you, Dr. Callender, for those great words and inspiring words, and giving us a task of what we need to do in the future. Once again, we'd like to thank each and every one of you for joining us this afternoon. I hope you were enlightened as much as I was. Once again, thank you to all the panelists, all the guests who shared some great wisdom today. And as you as the listening audience, I'll leave you with my famous words. If we sit by and do absolutely nothing, 0 lives will be saved. So please register your decision to become an organ and tissue donor today. Thank you so much, and we'll see you next time. Have a great day.